You are welcome to a bit of a global update for the weekend. Cases increasing in Europe, but seem to be going down in the United States and going down in other places as well. So a bit of a mixed picture in terms of trajectory, but always interesting things going on. So let's start looking at Europe first of all today, I think, after the global review. So these are the official global numbers, which we know are underestimates, but basically 25 million official cases now, so even the official numbers are getting quite high. Now these are areas where there's most doubling of cases in the past 28 days. More than twice as many cases in the past 28 days. I'm not going to go through them in detail, but it's interesting to notice that in Asia we've got Jordan, Lebanon, Myanmar, which was Burma of course, and South Korea. Increasing cases. These are increasing areas in Africa. Other areas in Africa are decreasing, so it's not a homogeneous picture in Africa by any means. Increasing cases in the Americas, Europe, notably there, France, Italy, and I would have thought Spain could have probably been added to that list as well. And Oceania, New Zealand, increasing cases, but very small overall numbers. And of course we could have listed places where infections are the same or even going down. Now I want to look at Europe first of all this morning. Now I think to start off our Europe review we'll look at a few graphics first of all. Now this is the situation in France that we have here. So we see that this is the number of new daily confirmed cases in France. And this was at the height of the outbreak in France in March, April time, just before the lockdown was imposed. And we see it's about 4,500 new cases a day, about 4,500 new cases per day. But now we see that the number of new cases now, at the end of August, is actually slightly higher than that. So the number of cases in France is actually really quite high now, the number of new cases. If anything, higher than it was at the peak. But if we look at the death rate in France, we'll see it's remarkably low. And in fact, you can't really see that on the linear scale, so we'll go on to the log scale. And we see that there's there's still deaths, but very small numbers of deaths. About 12 deaths a day in France, as opposed to well over 900 at the peak of the pandemic. So that's interesting for France. Now, is France a unique case? Is this unusual? Well, let's look at the figures for Spain. And we find that they're really remarkably similar. A little bit higher, if anything, in Spain. So here's the Spanish picture. And again, we see the same. So this was the height of the pandemic here. And now we see that there's the same number of cases, virtually the same number of cases per day in Spain. So basically a return in terms of new cases to where we were. But then if we look at the number of deaths in Spain again, we see they're remarkably low. And to get a bit more detail on the log scale, again, we still see that's about 30 deaths a day in Spain, as opposed to over 600 at the peak of the pandemic. So what is going on here seems to be that there's infection in a lot of infection in younger people. So the death rates are remarkably low. So most of this spread seems to be in younger people. And I think while we're looking at these graphs, we'll just look at the situation in the UK and Germany as well. This is actually the German graph here. The lockdown measures causing a dramatic reduction in cases in Germany. And Germany and the UK, slight increases in cases, not a lot really. This is the UK line here. So Germany and Germany and the UK, kind of similar figures really. This is the death rates again. So terrible death rates here. This is the UK death rate here. This is the German death rate down here. German death rate was much lower. This was the height of the pandemic, and this is now. So again, to actually be able to see this, we go onto the log scale. Again, we see that deaths are relatively low. So even the UK here, this is 10, 20 line on the log scale. We see that they're relatively low. So, yeah. Again, we're seeing high case numbers, a lot of case numbers, but relatively low deaths. So, but what does this mean for the coming months is the question. There's so many cases now, and we're not locked down like we were in March and April. So I think in Europe we're going to carry on seeing an exponential rise in cases over the next few weeks. Those lines don't look like they're going to flatten out anytime soon in many European countries. And my concern is not the deaths at the moment. My concern is that these younger people are going to be spreading the infection to many older people, and thereby propagating the pandemic and the deaths. That's the key thing. More vulnerable people could well be affected by this. So let's look at a little bit of detail here. So this is the situation in Germany. Now this is Chancellor Merkel. We have expected that some things will be even more difficult in the coming months than in the summer. So she's expecting things to go on being difficult. It's serious as it ever was, and keep taking it seriously. So it's not going away. Angela Merkel. We have to keep living with this virus, and life cannot go back to normal until a vaccine is found. So again, world leaders there confirming the need for a vaccine. And specifically in Germany, extension on ban on major public events in all 16 regions. Encouraging in Germany now, they seem to be acting much more federally. So things seem to be more coordinated in Germany, which is what you'd expect really for German organisation, because in the early stages of this, you had different regions of Germany kind of doing their own sweet thing, but it seems to be much more coordinated now. And things are being enforced. There are fines for not wearing masks and in places like shops and public transport. Now, the German authorities have identified some drivers of infection. Remember, these drivers of infection are so important. Local celebrations, returning holidaymakers, and people have just become... The people's guards have gone down. Hygiene measures have slipped. Social distancing measures have slipped. People are just not being as vigilant as they were. And no decision has yet been made on the famous German Christmas markets. Now, the Office for National Statistics data from the UK. First of all, the data from the UK, that's the official cases. So it looks like we've got about 3 million infections in the UK now, because it's 10 times that, isn't it? We know it's at least 2.8 million in England and Wales. So well over 3 million is roughly where we're at. Now, these are the deaths recorded by the health authorities, and these are the deaths in England and Wales recorded in terms of death certificate data by the Office for National Statistics, up to the end of the week, ending the 14th of August. So even in the UK, with two official data sets here, we are seeing these two different numbers. And it's just so ridiculous. The Office for National Statistics is recording data for England and Wales separate from the data from Scotland. So it's ridiculous. We've got data for Northern Ireland, we've got data for Scotland, we've got data for England and Wales. It should be all together as one country. Why we don't do that, I have no idea. It would seem to make much more sense. But the Office for National Statistics data, 28,200 cases in the community. This is the week ending the 14th of August. So 0.05% of the community population. And remember, this excludes cases in hospitals and care homes and prisons and things like that. So this doesn't seem to be going up very dramatically at all. So, I mean, that's basically good news. And the deaths, as we've seen, are remarkably low. 139 for that week, 1.5% of all deaths. And the number of deaths involving COVID-19 decreased or remained the same across most of the country. London was an exception. The deaths were up quite significantly in London. But most of those were, or a substantial proportion of those, were in hospital deaths, because London is where there's a lot of specialist care given. Centres of excellence, so quite a few of those are in hospital deaths, so it doesn't really represent it. Now, I think we'll just look at some data from the Office for National Statistics in graphical form, because they publish such good graphics, it's a pity not to use them. So this is the number of excess deaths involving COVID-19 continues to decrease. So here we see the time span along the bottom. The deaths from COVID-19 are in blue. Death not involving COVID-19 in green, and we see the proportion carries on going down. Very small at the moment. And the number of deaths involving COVID-19 was highest in males across the majority of age groups. So here we have the age groups: men, men, men. Only in the older age group are more women dying than men. And this pattern has been basically seen for some time now. And this is deaths registered in the UK, and again, this is all deaths and COVID deaths. So we see at the moment the COVID deaths have dropped down really dramatically. So pretty good news in terms of numbers of deaths. And of course, all these new cases does mean that herd immunity is steadily increasing, because more and more people are being exposed to the virus and therefore becoming immune to the virus, I believe, contributing to herd immunity. Now, the Tracker app, the King's College Tim Spector app, new daily cases are slightly lower than those given by the Office for National Statistics. But the Office for National Statistics, you might remember, the Office for National Statistics counts, they base their data on antigen surveys. So, of course, they find out that people are antigen positive that have the virus that have no symptoms. That's why the Office for National Statistics numbers are higher than the COVID Symptom Tracker app that we all fill out every day. So active cases according to the app just under 20,000. Now, the Greater Manchester, Lancashire, West Yorkshire lockdown. This happened on the 30th. It wasn't actually a lockdown, but 4 million people were ordered not to mix in each other's households. And a great fuss was made about it at the time. But it's a pretty straightforward, commonsensical measure, because inter-household mixing had been identified as a driver of transmission. And this is exactly what we want. We want to identify where the transmission is going on and what the local drivers are and act in a specific way to combat those local drivers. And that's exactly what was done. And it's worked. It seems to have worked. So they're lifting these restrictions on the 2nd of September. So that is good. Now, just before we leave the UK and Europe and go on to the Americas, just something that's annoyed me here. I'll just point out briefly, I think. There we are. Now, this is from the BBC. Coronavirus vaccine frontrunner, China already inoculating workers. Now, it turns out that the Chinese have got a prototype vaccine and they are giving it to a few workers. But this is the headline in the BBC. National website headline. And it's just incredible that they are saying that people are being inoculated with a vaccine. So, the verb to give a vaccine is to inoculate. It's wrong. It is inaccurate. An inoculation means to give live organisms. So if I stab myself with a dirty needle and there's hepatitis B virus on it, that is an inoculation injury. Or when Edward Jenner rubbed live cowpox virus into James Phipps's arm in just before 1800, that was an inoculation. It was the live organism. It's all the different in the world. Vaccination is an attenuated organism, or something that represents the attenuated organism designed to generate an antibody response. It's a different thing. Now, both of them can give rise to immunisation. Both of them can cause immunity. But to say, to use inoculation and vaccination interchangeably is plain ignorant. And yet this is the British biased corporation. I mean, the British Broadcasting Corporation. So it really is, you kind of put up with this and you get used to it. But we've got the BBC in this country, which is so influential. Lots of people still watch it. And as far as I know, none of the journalists reporting on this crisis are nurses, doctors, pharmacists, physiotherapists, anything like that. They're all journalists, and they simply don't know the medicine, and you can tell they don't know it. It's just incredible. Why are we not being taught about the vaccine or the pandemic in any way on all our national outlets by people that actually know what they're talking about? These journalists simply don't know the medicine, and you can tell they get it wrong. I'm sure they're very good journalists, but this is not just in the UK. In many cases, the journalists simply don't understand the medicine. If you wanted your car fixed, you'd go to a bricklayer, wouldn't you? Or if you wanted a wall laid, you'd go to your accountant. Or if you wanted financial advice, you'd go to your doctor. Of course not. It's absurd. End of rant. Sorry. But it just struck me how absurd it is that these people are getting basic medicine wrong, and yet they are supposed to be the leaders of the nation. Right, Spain, as we saw, we didn't see, but we do know Spain has got greatly increasing cases. Or did we see Spain? Yes, we did see Spain, didn't we? Let's just remind ourselves. We saw the greatly increasing cases in Spain. Basically back up to where it was, unfortunately. So school children aged 6 and over must wear masks to class now. So it looks like Spain have been identifying school children as infection drivers, which is interesting. But basically in Spain, France, I'd have to say, it looks like spread is now out of control in these countries. And it looks like it's going to carry on exponentially increasing as it has been done over the past few weeks. So quite what that means we don't yet know, but cases are now spreading as quickly as they were at the height of the pandemic before lockdown. And make no mistake, there's no more plans for a European lockdown. So there's going to be massive increase in cases, and this is going to coincide with the winter months. So it looks like, to me, the most significant time of this pandemic is actually going to be this coming winter, when we'll find out what it's going to do. Now, moving on to the Americas, the United States. 6 million cases in the United States and a lot of deaths. Now, the president has just announced that he's got 150 million rapid COVID-19 tests. You would think he was getting 150 million, you might get them a bit cheaper, but it does come down to $5 each. And this is a new test, and it's going to be only going to take about 15 minutes, apparently. So I'm assuming it's a saliva test because it only takes about 15 minutes. Now, if this works and if it's readily available, that is a massive, massive potential game-changing event if everyone could know every morning whether they were positive or not. But it's a bit complicated, as we'll come on to see. And the president also said there's going to be a safe and effective vaccine this year. That is optimistic. Let's leave it at that. Hope is right. Hope he knows something we don't, but it's optimistic. Now, this thing about the Centre for Disease Control changing its advice on testing people that have been in contact with people that have been with confirmed COVID-19, but not getting tested, or not mandating testing, saying testing could be done on the discretion of the healthcare providers. Now, 7 states have said they're going to disregard this Centre for Disease Control advice on testing those that were exposed but asymptomatic. So what the Centre for Disease Control is saying, and we did look at this in some detail a few days ago, they're saying that people that are symptomatic will probably need tested, but people that have been exposed to the virus, that was less than 6 feet away for more than 15 minutes from an infected person not wearing protection, if they've been exposed, therefore likely to be positive, they don't necessarily need tested. And that was the advice. Now, these states have said they're going to ignore that. So they're going to ignore that, and they plan to continue to test asymptomatic people who have been exposed. So America divided there yet again unfortunately. What I'm thinking is the Centre for Disease Control. See, the problem here is the Centre for Disease Control has not really revealed its thinking. Why has it done this? Now, it may be because of this reason. Let me tell you. So let's suppose that someone is infected there on that day. So that's the day they're infected. They're infected. And then we know that people can develop symptoms anytime from day 2 all the way through to day 14, potentially. That's the time when they can develop symptoms. Now, the PCR test is remarkably sensitive, and if there's any viral particles there at all, it should detect them. But the CDC might be thinking this: well, what if someone gets infected then, and they get tested then, because they know they've been exposed, so they get tested the day after. Now, what the Centre for Disease Control has been saying is that test could come back negative, but then the day after or the day after, although it doesn't say the day after, it just says some point in the future, they could test positive. Now, if this is the case, then the Centre for Disease Control thinking makes scientific sense. So if someone's infected then, test negative then, but then suppose they tested positive, they would test positive then. But of course, they don't get tested again then. They're back at work. They're back socialising. They're back out going for a drink with their friends. So that would mean that when someone was tested there, I'm just making up that time, I don't know when it is. That would mean that the person was tested, got a negative, and it turned out that that was a false negative, that the virus hadn't replicated in their cells yet, enough to give them a positive test. They would think, oh, that's great, I'm negative, I'll just go back to my normal life. But then if they'd been tested a couple of days later, they might have been positive. So there's a risk of early testing being negative. I think that might be what the Centre for Disease Control is thinking. And if that's what the Centre for Disease Control is thinking, it's one heck of a good idea, because it means that people who have been exposed to the virus and know they've been exposed can just self-isolate. They don't need a test. They can just self-isolate for the 14 days. Well, I think the US criteria is 10 days. But they can just self-isolate, assuming that they've been exposed, and see if they become symptomatic during that time. Whereas testing might actually increase transmission of the virus because it gives a false sense of security by giving a false negative. Now, if that's their thinking, that's actually quite clever. And if that's their thinking, that means that the people that make the decisions in all these states don't realise that and have got it wrong. But I don't know which is which. So I don't know whether the CDC are wrong or these 7 states are wrong, but one of them has to be. And it would be clarified if the CDC would release data on how many people will test negative 1 or 2 days after exposure, who will then go on to test positive in the future. That could be their thinking. And if that's the case, that's quite clever, because although the Centre for Disease Control has made errors, in my view, in this pandemic, there are a lot of clever people work there, but we need more rationalisation from them. They need more public communication so we know what their thinking is on that. But I've got a hunch they're actually being quite smart on that, and I've got a hunch they're actually being right. So because of the risk of a false negative in the early stages after exposure. So hopefully they'll clarify that. Now, one case of reinfection in Nevada. It's on the news. So as far as I know, in the United States, one person has tested positive for a second time with a different strain of the virus out of everyone in the United States has been infected. I'm sorry for that individual person. I'm not worried in terms of the course of this outbreak. I think reinfection is going to be turn out to be very rare, and I think this is a bit of a red herring that the media's kind of latched onto. So I'm not worried about that. If I'm proved wrong, so be it, but I don't think I will be. If I am proved wrong, I'll be back on and I'll tell you. But that's my thinking so far. Still in the Americas, Canada, extended barring most foreign travellers until the 30th of September, and the agreement with the United States goes on to the 21st of September. So Canada, we've got to bear in mind the population is relatively low, but that's the cases and that's the deaths. So Canada has acquitted itself really quite well so far. But to be fair, it's a big country, it's a small population. They had a few things on their side. Now, going on down to the Antipodes, down to Australia. Yeah, Australia's interesting. It's done remarkably well, and then it had this kind of blip in Victoria. 94 new cases in the past 24 hours. That's down. So it's the first time it's dropped below 100 since the 5th of July. So the direction is looking good in Victoria. Restrictions have been extended up into Queensland as well, I think, and onto the Gold Coast. So still not over yet, but it's looking good so far. The thing that's concerning in Victoria is there's well over 4,000 cases of unknown origin. And of course that means there's community spread. There's spread without an epidemiological link, which of course means the spreading is going on invisibly. We can't see it. So quite a lot of cases of unknown origin. So the direction is good, but still a way to go. Now there's 18 deaths in the last 24 hours, but 16 were in aged care facilities there. So again, the pattern repeating of what we saw in March, April in Europe, with people in care facilities unfortunately dying at a massively disproportionate rate. Melbourne, another fortnight on strict stage 4 restrictions. It is being enforced by the police. And if you live there, you can, I'm sure you're familiar with this, actual curfew from 8 till 5, only allowed out for work and medical care or caregiving, leaving home for essential activities. That's a hyperlink, click on that for permitted work. So the restrictions go on and people are advised to, are mandated to stay at home as much as they can, and face covering is mandated in public. So it's taking quite a while to get the cases down. There's still community spread, but the direction is good. And the authorities in Melbourne particularly do seem quite determined to get this well down before they ease restrictions very dramatically. And overall, I think that's probably good, because that means this is not going to spread around Australia as it has the potential to do. So far so good. I know it's difficult, I know it's expensive, but so far so good on that. And, you know, the New Zealand example just shows how islands, and Australia is an island, it's a heck of a big one, but it just shows how effectively they can control this pandemic. Moving on to New Zealand, 13 new cases in the past 24 hours. So it hasn't gone away. 137 active cases. But New Zealand are tracking and tracing all close contacts of these cases. So because of this, I am optimistic that New Zealand can get back to where it was. And if you click on, I think it's that link there, you actually get really good live data from New Zealand from the government website. All close contacts, of course, quarantine. So basically, New Zealand doing the right thing. All close contacts remain in isolation for 14 days. India, I've been in contact with some friends in India, and the hospitals there are still remarkably busy. But the number of new cases in Mumbai and Delhi does seem to have levelled off and does seem to be going down. And to tell you the truth, I don't quite know why. It looks like there may be some herd immunity phenomena going on there. Now I'm hoping to look at this in more detail, but what it looks like in some of these areas where there's been a large number of cases very quickly, is that quite a large proportion of the population have been exposed. Maybe 20-25% have now had the virus, could be even higher. They've developed some form of immunity. But of course, the question is, why is it not spread to all of the community? Until 70% have been infected, that gives us the herd immunity that we would expect. And what I'm starting to suspect, and I don't have evidence for this yet, but because we're seeing the number of new cases fall off in some parts of South, I mean, it's still huge in South America, but the rate of acceleration is not. The rate of acceleration is reduced, and the number of new cases per day is going down in many areas. But we haven't yet reached the 70% for herd immunity. So I hadn't expected that to happen at this stage. It's happening around about the 20% infection, 25% infection mark. New York is another example where that seems to have worked. Now, this is me speculating at the moment, but so what's happened rapidly is people, 20-25% have been infected, and then the acceleration rate, which we would expect to carry on to 70%, is not happening, or doesn't seem to be happening. And what may be the case is that quite a large proportion of the population already have some immunity to the coronavirus, SARS coronavirus 2. Now, how can that be? Because it's a new novel virus. And we've always been saying that everyone is vulnerable to this virus. Well, it could be that cross-immunity effects to other coronaviruses and various other viruses and antigens in the environment have given a degree of what we call cross-immunity. There could be a degree of cross-immunity where immunity is enjoyed to a virus which we have not been exposed to because we've been exposed to a similar virus. Now, that's me speculating. I don't know, but in places like Mumbai, Delhi, parts of South America, the pandemic is not carrying on accelerating as we would have expected. And that's the only reason I can think for why that would be so far, that a proportion of the population may have a degree of immunity. More on that as soon as I get it. Don't write that down. Just let it mull over in your mind, because I don't have firm evidence for it. But it would make sense. Now, I know I keep mouthing off about being evidence-based, but that's a hypothesis that could potentially explain what we're seeing. That there is some immunity to COVID-19 already in the environment. It's a hypothesis, and we'll have to look for further data. It could be in a couple of weeks' time I'm on here saying I was talking absolute rubbish. We could reject that hypothesis, or there could be evidence accumulating for that hypothesis. Time will tell. But it would vaguely explain what we're seeing at the moment. Now let's just close with... Of course, we're all desperate to know where this virus came from. Where did it come from? Is it just coincidence that the Wuhan Institute of Virology is a few miles away from the outbreak origin, from ground zero, as we might say? Is that a coincidence? The World Health Organization seem to want to find out. The Chinese are collaborating. So they want to find out the origins of the virus. So a small team from the World Health Organization, I think 2 people, has gone to China to try and check it out. They didn't visit Wuhan. They were in quarantine for most of the time, and they had lots of video meetings, which they could have done from the Antarctic. And there are international investigation into the origin of SARS coronavirus 2. Seems to me that I don't really see the point in that trip. Most of it was on video conference, which they could have done from anywhere. Anyway, I don't know the details, but this Australian MP has been looking into it. It's another disturbing incident of the World Health Organization, which is charged with safeguarding global health, putting the political sensitivities of a member state above the public health interests of the world. I don't know, that's what he's saying. Larger team is going later this year. The larger team will visit Wuhan. And Chinese scientists are currently working flat out on it, so we are told, so we're hoping for something soon. Okay, so I think that's about us for today. I think I'll just show you actually a couple of graphs I didn't show you from the United States. These are the number of new cases in the United States. Now, this was when the reporting method in the United States changed. So the cases started going down just as the reporting method was changed. Not saying that these aren't genuine, it's just a bit unfortunate that it was a bit of bad timing there. The cases in the United States do seem to be going down, which of course is good news. Having said that, that's still an awful lot of new cases per day. We're still at about 40-odd thousand new cases per day. But that is the linear scale, so it does give you a fair idea of what is going on with new cases in the United States. And in terms of deaths, they are going down, but not that dramatically. So death rates are still hovering remarkably close to the 1,000 level in the United States. And of course, I don't know if I mentioned this when we were talking about the States, but there's so many other things going on in the States. We've got Louisiana, for example, in devastated by the hurricanes. Then we've got mass protests in Washington. Now, it's not the mass protests that bother me, but because they're outdoor. Okay, there's a lot of people close together. But you've got to think, which toilets are they using? What's the hygiene like in the toilets that those thousands and thousands of people are using? How are they getting there? How are they travelling? Where are they accommodated? All of these things. It's not just looking at the headline TV pictures, it's looking at everything that goes behind that. You've got to kind of look at the whole picture. So, and then there was the fires in California, of course, which do seem to have, I don't know, I haven't heard news on those. They were still going a couple of days ago. It's been a lot of things all at the same time. So hopefully things will start to improve now. Anyway, okay, thank you for watching. I'm rambling on a bit. Thank you for watching. Do have a great weekend.